Is Med Scrub Insights. Today we are going to discuss on diabetes mellitus. Yes. So diabetes mellitus definition. Diabetes mellitus is a chronic disease with metabolic, vascular, and neurological disorders resulting from dysfunctional glucose transport into body cells. So this one, the problem here is as a result of the transportation of the glucose from the blood into the cell. So these are the mechanisms. So when there's the blood, after you've eaten, there will be the breakdown and so on and so forth. There will be a breakdown of the foods that you have eaten. After that, they'll be converted into what? Into glucose. They'll enter the blood. Now, since they're in the blood, insulin is going to be released. When insulin is going to be released, insulin is going to make the glucose. In short, it's going to facilitate the absorption of glucose into the cells. Yes, so now this second mechanism is where we have got two problems. One, when there's a problem with secretion of insulin, and also the problem with the problem with the glucose now entering, the problem of insulin now finding difficult, having poor action to facilitate glucose absorption into the cells. You find that because there's no or poor insulin action, you're going to find that glucose will remain in the blood, thereby causing high blood sugar. And the complication of high blood sugar, one, we have got metabolic, vascular, and neurological complications. Causes of poor insulin production, one, we have got genetic, immunological, infection, and environment. Then the classification. This classification is based on its cause. Type 1, we have got insulin dependent diabetes mellitus. Yes, this one is the one to do with secretion. There's a problem in secreting of insulin. Type 2, non-insulin dependent diabetes mellitus. In this type, you find that insulin is there, but for it to act on the cell, for it to facilitate the absorption of glucose, is not there. It's the one that it's a problem. Now, we've got type 3 diabetes mellitus associated with other conditions. When we've got other conditions, also they're going to contribute. We have got type 4 gestational diabetes mellitus. This one is diabetes that is due to pregnancy. And also we have got diabetes mellitus type 5. And then now let's start with diabetes type 1. So diabetes DM type 1 accounts for about 5 to 10% of all cases, more in women than men, and individuals are nano-based. They are nano-based. Yes. The onset is sudden. There is beta cell destruction, usually leading to absolute insulin deficiency, and the person requires injection of exogenous insulin to maintain life as no or little insulin is produced. So, in this type, the immune system is the one that destroys the beta cells. Thereby, because the beta cells are the one that are responsible for the production of insulin, this one will lead to insulin deficiency, to absolute insulin deficiency. And these people, they are going to require injections of exogenous insulin to maintain life, because since due to insufficient insulin production. So these people are going to require insulin from outside, because their pancreas is that pancreas is unable to produce insulin because the beta cells have been destroyed. So you find that these individuals are prone to ketosis, and also appear early in life, and the cause is unknown. But many this one they usually refer to it as the juvenile. Yes, because sometimes they refer to that as a genetic. Yeah. So you find that the reason why individuals are prone to ketosis because the body needs energy. So to switch from using the carbohydrates now to switch to using the ketone bodies for the energy, to switch from carbohydrate to fats so that it can produce energy from the ketone bodies. So these ones are prone to ketosis. So type 2, this one accounts for 90 to 95% of total diabetic population. So in this one, individuals are obese over 30 years with a positive history of diabetes mellitus in the family. There is inappropriate insulin production due to insufficient amount or delayed response to a glucose load. High glucose in the blood is related to increased resistance to insulin at cell level. It's related to increased resistance to insulin at cell level. Yes. On this one, because this one is to do with the receptor on the cells, insulin receptors, the where insulin binds on the cells, they are going to get what? They are going to the cells on the insulin, the insulin receptors are the one going to what? That are the problem here. They are not working properly. So find that there will be insulin resistance. So find that when there's insulin resistance, the body will think that there's little insulin. So meaning it will cause more insulin to be produced because there's too much glucose and insulin is what is produced, but there's resistance at a cell level. There's resistance at a cell level. Now the body again will cause the more production of insulin. This is the reason why this is one here is written in. There is inappropriate insulin production because this one there is it's related to increase resistance to insulin at a cell level. So find that this one it comes because of the lifestyle. This is what we discussed in the other video where we talked about to say people should eat whenever they feel hungry, because when the insulin levels are always high in the body, it will lead to insulin resistance. We discussed this in the last video that we made. So this one is treated with diet or hypoglycemic agents if glucose persists, or insulin if hypoglycemic agents do not work and they are developed diabetic ketoacidosis. Yes. So this one you control with diet, you avoid sugars, and also you do a lot of exercise. Yes. So type 3, formerly called it's called Tudari diabetes. So caused by unidentified cause, including pancreatic disease. It was one of the complications that we discussed from the last video that we made on the acute pancreatitis. Check out the video. in the playlist. So hormonal dysfunction like pheo, like pheomochromocytoma, acromegaly, chemical or drug causes, or insulin receptor abnormality, like like the type 2. So type 4, this is gestational DM. This one occurs as a result of stress of pregnancy due to glucose intolerance during pregnancy in 2 to 3%. Type 5 malnutrition related DM. Recently added by World Health Organization, occurs in 10 to 40 years of age in underdeveloped countries. Yes. So epidemiology. This one affects 11 million in USA with a prevalent rate in elderly over 65 years of age, cast across race and sex. Hospitalization rates are 2.5 times greater in adults and 5.3 times greater in children with the DM than the general population. So, the cause of type 1. This one is genetic factors, immunological factors, environmental factors. Also, they play a role. Type 2, we have got this one is idiopathic predisposing factors. We've got age common in the over 65 years. We've got obesity, people who are obesity, and also family history, and also ethnic group in USA. And also pathophysiology we already discussed when we are mentioning the type. So clinical manifestation, what do you see? We've got hyperglycemia, polyuria, polydiphagia, polyphagia. Others include weight loss, fatigue, acid on breath. This acid on breath, this one is due to the breakdown of ketone bodies. We've got increased acetone, glycosuria, tingling and numbness in the hands due to neuropathy, slow healing of ulcer and recurrent infections. So, but the key things here, we have got polyuria, polydipsia, polyphagia. So, how do we manage? First, we start with investigation. We start with a history. We start with the history. In history, we go for the risk factors that can dispose this person into diabetes, lifestyle, all those things that we have discussed. Family history, increased appetite, weight loss. We ask all these things. Increased taste, polyuria. Sorry about that. Polyuria, polydipsia, prolonged healing of wounds or ulcers, impaired vision, change in alertness, all these things. So we come to physical findings. If this person is obesity, poor healing of ulcers, etc., we go to a blood test. We use random blood sugars, fasting blood sugars, postprandial blood glucose, oral glucose tolerance test. These are the tests that we can use. So how do we treat? The objective when we treat is to keep sugar levels within normal ranges as much as possible, alleviate symptoms, and also minimize long-term complications. So objective, I want to keep sugar levels within normal ranges as much as possible. Also alleviate symptoms and minimize long-term complications. So there are two main treatment faults here. We have got non-pharmacological treatment and also pharmacological treatment. So non-pharmacological treatment, we talk about dietary management. So objective is to maintain ideal body weight and ensure normal growth. Plan diet with adequate calories, protein, vitamins, and also minerals are used. Exercise is important because it promotes utilization of carbohydrates, decrease cholesterol, and also triglycerides levels, and also monitoring Close monitoring of glucose level is very important. The control of DM, finger, stick, and urine test may be used to monitor. And also eating anyhow. Eating anyhow also predisposed. You should eat when you feel hungry. Pharmacological treatment. The second one, we have got oral hypoglycemic, effective and commonly used for diabetes. We have got sulfonylureas, commonly used and also increased the insulin release from the pancreas. So problem analysis using Roper Rogan Tierney model. So maintaining a safe environment. The patient is at risk of infection related to increased glucose levels in the body tissue that attracts microorganisms. Remember, there's increased glucose levels in the body tissue that attracts microorganisms. So, and again, we find that there will be increased infection. So this patient should be on antibiotics. Risk of wound infection due to compromised immunity. Leg ulcers, also altered body weight related to utilization of fats and protein. Remember, there's little glucose in the body, so which means the body will switch from using carbohydrates into fats. These fats, remember, the person will lose weight. Dehydration due to polyuria. This polyuria is the person will be dehydrated because they urinate much. Risk of falls and injury due to impaired vision. They are going to have impaired vision. So, 2. Communications. Communication. Patient will be anxious due to hospitalization and conditions. Patient will be withdrawn due to fatigue, increased hunger pangs, and polyuria. And also breathing. Eating and drinking. Patient will eat a lot due to breakdown of fats and protein, sending signal to hypothalamus that no, I need to eat. Polydipsia, increased osmolarity stimulation thirst center in the brain. So they are going to drink a lot of water. Weight loss due to increased cell breakdown without storage of glucose. And also I've got elimination. Polyuria related to increased glucose, which acts as an osmotic diuretic. Glucosuria, presence of glucose in the urine as the kidney try to remove excess glucose in the blood. We're going to have constipation due to increased food intake with reduced water supply to the bowel, because this water supply is being lost. This water is being lost through the urine. So the person is going to be dehydrated. Of common personal cleaning and dressing. You find that the patient will not be able to perform his usual personal cleansing due to fatigue and condition. You are going to have controlling body temperature. The skin is usually dry and cracked. Patient has used fat tissue, hence risk of hypothermia will kick in. Mobilizing. Altered mobility due to fatigue, work and playing. So patient will be isolated and lonely because of fatigue and polyuria and hospitalization. Expressing sexuality. Patient will not be able to perform his gender roles due to condition and fatigue. Patient will not express sexuality due to loss of self-esteem due to the presence of sores on the body. Rest and sleeping. There will be insomnia due to nocturia. Patient will have sleep disturbance, feeling of waking up at night to eat due to hunger. Dying, fear of death due to the illness. So, nursing diagnosis, we have got one, alterations. So this one is the end of our discussion on diabetes mellitus. So subscribe for more videos like this. Mediscribe Insights.